Hello, this is Dr. Birchler from Chiro Health Spine and Disc Center. And the picture on the screen here is showing in a colorized image the common pain pattern of a herniated disc in the neck. Now there are multiple discs in the neck and the pain pattern can be a bit different on each one of them, but you'll get the general idea from looking at disc, which is probably the most statistically the most common disc to be herniated and the associated pain pattern. So the dark red areas here are areas where there's commonly intense pain, sharp pain, aching, that kind of thing. This dotted area here down in the arm would be commonly areas that could be pain, could be burning, commonly tingling, numbness, those kind of sensations, even weakness into the hand and the ability to grip. So if you imagine trying to hold your index finger and your thumb together and kind of pinch them together, and then if somebody could, it should be strong, and if somebody pulled that apart, could be weak. You can get weakness from these things as well. Now this can be confusing for patients. I see this misdiagnosed or missed in a lot of cases at going to many doctors or therapists or things. The pain can be worse in the shoulder blade, sometimes down at the bottom corner of the shoulder blade or right between the shoulder blades, sometimes right in the top of the shoulder blade. And it may be worse actually in the shoulder or upper arm even than the neck. And so people may think they have a mid-back problem or a rib out or something like that. They may think they're having a shoulder problem or rotator cuff problem. And while all those things are possible, there can be some confusion here with a problem in the disc of the neck. Now, some tells that this would be actually a disc problem would be tingling, numbness, pain down into the arm or hand, also any kind of weakness in the grip or in any of the muscles of the arms. Additionally, on a physical exam, if somebody had a reflex checking the muscles of the arms and that reflex was either kind of diminished or possibly excessively brisk, those could be physical exam signs of that as well, amongst others. The imaging to actually see a disc herniation would be an MRI. You actually cannot see a disc herniation on X-ray. This shows somebody's neck and a somewhat small but significant disc herniation. If you imagine the disc like a jelly donut, here's the donut, and this jelly here should all be in the donut. So if the jelly comes out of the donut and hits into the spinal cord, or the nerves coming off the spinal cord that eventually go to the sections of the arm or hand, you can get symptoms as we just discussed here. If this is something that you're dealing with, possibly haven't gotten results with, not sure what's going on, maybe haven't had a proper evaluation, we'd be happy to try to help you with that to get a clear indication of what's going on and get to the root of the problem here. If so, get in touch with us. We'll do our best to identify the problem and direct you.